Krista, welcome to the Jacked Up podcast. I am super excited to finally get you on this show.
I am so excited to finally be here. We must be talking about some seriously important stuff today for so much stuff to happen.
It must be because we've tried this a couple times and you've had issues on your end and I've had issues on my end and we're finally making this happen. So I got a feeling that this is going to be an awesome episode. So I kind of gave people in the intro just a little bit of a teaser as to who you are and what you do. But for those that really didn't pick up on that, not to mention the fact that I want you to go a little deeper, why don't you tell us your story of how you went from being a pharmacist to doing what you do now?
Sure. Grab some popcorn. Actually, don't grab popcorn because that's not low carb. Okay, so so I am still a clinical pharmacist. I just use it differently now. Because all that clinical training that taught me how to look at research and look at studies and look at numbers and really see the data is actually what kind of kicked me over into realizing, whoops, I'm not treating diabetes properly and I'm actually making people more dependent on medications. Whoops. Well, that came around a few ways, actually. All of, the perfect storm of life does this to us. It came about from one really stubborn patient who I should have been able to help. All of my perfect standards and, algorithms should have been able to help, and it didn't. And that kick-started me into thinking, okay, I must be missing something. I'm missing something, right? It must be because I studied really hard. And so for one complicated person looking for my help to throw me off, what was it all worth? Okay, so, and I dug deeper and I realized the clinical guidelines that we base all of our standards of practice, our best practices on, what's a good word? What's a polite word? We're lacking some really good science. Mm-hmm. Did I just say that out loud? I said that out loud. Yeah, it's true, though. It's true. And so when you look at the reference numbers of what the data is based off in the science, you can go down to the reference section and you look at that. And then you look at that study, and then that references another study that really doesn't have any data. And you're like, oh, wow. So that was completely arbitrary, AKA made up. Yeah. Okay. Made up by a group of people got together who were experts and decided this is the way we're going to go. But that way has made us really, I'm going to use the F word, fat.
Go right ahead.
Fat. It's made us really fat and really have a lot of diabetes and we're still headed that way. So I'm like, oh no. So when you undergo that training and get the degrees and have all the letters, you also take an oath not to hurt anybody and do what's best for people.
Right.
Mm-hmm. Mm-hmm. And I happen to have that oath sitting at desk and I'm like, oh, I made, that's some serious stuff. That's not like a joke. And so I started changing people differently in the clinic, right? I started going away from, eat all the time. Mm-hmm. I swear, this is really what, if you want to distill down what people with diabetes are told, it's like eat every couple hours so your sugar doesn't go low. And here's all the meds and eat a whole bunch of whole wheat. That's really what they're told. That makes everything worse.
Right.
And so I'm like, all right, let's try something new. And like a Christmas miracle, my patients got off of drugs. They got off the meds. The insulin doses dropped dramatically. Right. The weight started to drop because insulin is it makes people fluffy, right? Mm-hmm. They felt better. They had more energy. Their blood pressure went down. They started seeing better. They could feel their legs again. Crazy stuff happened when we started feeding their bodies nutritionally appropriate things. Okay?
Right.
Okay. So I have a habit of just doing what I know to be right and then getting in trouble for it later. So I just kind of trenched my way through the clinic. And then something happened that just, changed my life forever. And that was my father passing. Mm. And my father went into the hospital and they diagnosed him with Guillain-Barré syndrome, which if you don't know is awful. Okay, it's awful. It's a bear of a disease, but most people survive, but he didn't. But this disease is not manageable, not treatable, barely understood. It's not predictable. It's not preventable, right? And he passed from it. And then the day after he passed, I can't even make this up, I had my third baby. So daddy passed away, had my third baby, had a newborn in my arms at his funeral. The person who understood me the most in this world, I just had to bury. Okay, so that sucked. But it pushed me to jump out of the clinic and do things independently and do things for people and give people what they need out here, because in the clinic I was buried and under a whole bunch of layers of HEDIS metrics and metrics and metrics and numbers and metrics and do this and do that and don't do this. And I had enough of it, especially when you go back to the clinic and you're treating a disease where all I really have to say is don't eat that, eat this thing over here and everything will start to get better. Okay. I have to go back to treating that disease after seeing a disease I couldn't touch. I couldn't do anything for my father. I couldn't help him. And I got super angry and I'm like, I'm doing this my way, the way that I know to be right and the way that helps people. And I don't care what anybody else thinks. I don't care what my colleagues who have been dead cricket silent think.
Yeah. And see, that's the thing. I mean, me personally, I got involved in doing what I do because of my own journey. Waking up after being in a diabetic coma, weighing 405 pounds. And it's like, okay, you've got to change your life or you're going to die. It's a huge wake up call. And through the whole process of getting rid of the weight and getting healthy, it just kind of built up an obsession in me to help other people do the same. Because when this all happened to me, I was scared to death. And unfortunately, a couple of the doctors that I dealt with were no help whatsoever. And it was just exactly what you're saying. It's like, take these medicines, do this and do this. The best information that I got within the first 6 months of being diagnosed as a type 2 diabetic was the hour that I spent with a dietitian. And I started to learn what food does in the body. And once I started to realize that, then I became obsessed and I learned everything I could about what fat, carbs, protein, all these different things, what they do and why they do it. And that's what led me to where I am today. So I completely get it. And I can only imagine from your standpoint, being a doctor, working in the field that you did and just being confronted every day with essentially mistreatment of something that, in most cases, especially type 2 diabetes, is preventable.
Yeah. Yes. And it's really frustrating. And I had providers who had a lot of trust in me. They would walk their patients down and be like, you are Dr. Ellow's responsibility now. And I'm like, come on in. The weather's great in here. And so we would handle that and manage it. But every now and then I'd have a conversation with a provider who would say, just do whatever fixes the HEDIS metrics, right? Meaning, AKA put this patient on any drug possible to fix that his A1C is, that he's screwing up our numbers. Right. And I remember what patient that was. And I looked at the provider who was honestly a lovely human being. He really was. They just get sucked in to this, they're getting hit from all sides, like from all the things they have to keep track of. And the patient we were talking about was already overweight. And so if I started insulin in this guy, it would have made everything worse. It would have skyrocketed his entire, he probably would have been on disability within 6 months if I did that. And I'm just like, I can't do that. With respect, no, I'm not going to do that. And then I'm sure you've seen the push where it's like, you have to be on this drug. You have to be on this cholesterol pill. You have to be on this. I'm like, first of all, you don't even understand the drug you're being prescribed. Okay. And you, the prescriber, don't even understand the drug you're prescribing. You don't even know there's a difference. You don't even know when you look at the cholesterol that there's a difference between the agents in that class. You can't tell me how it works. If you can't tell me how it works in the human body, why are you putting it into one?
Right.
Oop, exactly. That came right out, didn't it? It came right out. And it's just, if we understood, and again, I really don't like pointing it out because they get zero training. Like the pharmaceutical reps come in, that's their training.
Right.
But if you understood what you were doing, like you did, like you said, you go and understand, then you're like, okay, now I get it. Now let me tweak this, pull this, rub this here, get rid of that. And suddenly my body can function again. Yep. I really do use the metaphor for cars all the time because cars are great, because cars always tell you the answer's in here. I see you leak. I see you. Okay. That's the problem. Yeah. And when it comes to medications, we don't take the time to see what's the problem. And then we treat side effects with another drug. It's a mess.
Yeah, exactly. And see, and it's funny that you brought up the car analogy, because I like to use that all the time when I'm talking to people about, for example, how a body runs on carbohydrates versus how a body runs on ketone bodies. Okay. Because I spent 20 years as a mechanic, I can tell them, I can say, look,
Oh, cool.
you take two brand new motors, put 50,000 miles on each one of them. One of them's a gasoline motor. One of them's a diesel motor. The gasoline motor is like running on glucose. The diesel motor is like running on ketones. So now here's the deal. Run them for 50,000 miles and tear them both apart. When you tear that gasoline motor apart, there's all kinds of carbon and gunk and leftover waste from the burning of the gasoline, because it's not a clean burning fuel, where exogenous ketones are extremely clean burning. And the best thing of all, if you have too many of them in your bloodstream, you can eliminate them.
Yeah. Yeah. That is a brilliant analogy. I'm writing that down right now. Diesel.
Write it down.
Diesel,
absolutely.
And you could go further with diesels, because I've had people, come off the carbs and they're like, well, I felt really bad, and so my body must need it. And I'm like, well, don't use that same logic with cigarettes, honey bear, because that is not going to work. Yes. But anyway, I'm like, listen, a diesel engine takes time to warm up. You got to warm that baby up. Okay. Switching your machinery to run on naturally occurring fats and ketones. It also takes a little bit of warm up, a little bit of transition. Okay. But I know what doesn't work: putting sugar into or putting gas into an engine that should run on diesel. That doesn't work.
That's correct. That
is
absolutely
that's exactly
correct.
What we've done. It's really what we've done. And so, it's really hard for people to understand, because I'm sure you've seen this. We're almost bullied into eating these grains and these whole grains. Why aren't you eating your whole grains? Eat them. And I'm like, they cause your blood sugar to go sky high. Why are you doing that? Well, it's healthy. How is it healthy? Let's follow this line. And they just don't.
We were told it was healthy. We were told by all the people who followed Dr. Ansel Keys' research that we had to eat heart healthy grains and we needed to avoid saturated fat. The one thing that I'll never get out of that is the fact that your brain is made up of over 30% saturated fat. Your cell membranes are made up of saturated fat. How in the hell can you not eat saturated fat and expect your body to reproduce those cells, to be able to keep healthy cells in the brain and things like that? Yeah, I don't know where the logic got flawed. And you have to wonder how much there were financial reasons behind what was done. There have been accusations that a lot of those studies were funded by I'm not going to name any names, but like a lot of cereal companies and grain companies.
Yes.
Those studies were funded by those people to make it look like we needed to eat more grains and less fat. And
there are confirmed studies published in JAMA that shows the evidence that the damaging effect of sugars were buried and not published. And then we saw, and this was a Harvard professor who did this. Right. Are you serious? And then your brain implodes on yourself and you're like, oh my gosh. And you can see it when you look at the 80s. Remember the food pyramid? When you look at the 80s nutritional guidelines, it literally says in there's no evidence that sugar is a problem for people with diabetes or doesn't cause diabetes. Crazy. And then you look at today's, and there's a lot of the same verbiage, but they're starting to switch it. They're pushing the whole grain still, a whole bunch of stuff. And it's just what can I call a timeout? How about instead of looking at the pieces of paper, how about we look at the humans that you're in charge of? The humans you're in charge of, okay, have a lot of padding with love, okay? They have a lot of padding. They have a lot of chronic disease. And when it comes to diabetes, which is probably how I somehow ended up with the universe shoving me down this lane. If you have a disease that encompasses your entire body, where every vessel and nerve is surrounded by a high level of very toxic and very inflammatory sugar, that is going to lead to other disease. Bad disease. And we probably could, it's been linked to dementia and fibromyalgia and, a whole bunch of nervous disorders and a whole bunch of depression and anxiety, because it's a whole body disease.
Sure. Sure.
Of
And
course it is.
it's really amazing how in recent years a lot of the studies and stuff have showed that inflammation is the main cause of just about every problem in the human body. And what
Mhm.
they're starting to do now is they're starting to spend a lot more time studying what is actually causing the inflammation. And you're
Right.
exactly right. When you have diabetes, type 1 or type 2, you know,
Mhm.
that the elevated blood sugars and that stuff being all out of whack does nothing but increase your inflammation. And that's why you have so many other issues in all areas of your body. You know, I
Yeah.
personally experienced it with my mother. I lost her to complications from diabetes. And I mean,
Mhm.
and this happened before I found out that I was type 2 diabetic. And I remember everything that she went through, going blind, losing a leg, being on dialysis the last 3 or 4 years
Mhm.
she was alive. And when I had my diagnosis, I was like, oh hell no, I'm not going out like that.
No,
You know, and
no.
that's when I started to educate myself and make changes.
Absolutely. And you have to, it's hard. It's hard. There is,
Mm-hmm.
when it comes to advice, I find that if you have diabetes or you're pregnant, the
Mm-hmm.
unsolicited advice rains down on you.
Oh yeah.
It's almost unbearable. It is
Mm-hmm.
almost unbearable. And it's just like, listen, stop. Let's think about this. Let's think about this, okay? You have high sugars because you have diabetes. So why are you being told to eat food that raises those sugars? Okay, why? Why? Because it reduces the absorption of fat? Like that's usually the reason I find people are given for eating a whole bunch of whole grain and oatmeals and all kinds of stuff. And then I hear this phrase repeated over and over. It'll keep your sugars stable. When your sugar is 300 all the time, it is, yes, that is absolutely stable. It's not healthy. It's not helpful. It's going to cause a lot of problems, but
Right.
yes, technically you could call that stable. So I'm just wondering on the motivations of some of the advice. Now, I honestly think I think a lot of people like providers and who mean well, I think we just stopped thinking about it. I think we just,
Mm-hmm.
I think we just, what's on the guidelines? What's on the
Right.
guidelines? Okay.
Right. That's
Step
what I was
one,
going to say.
throw out
Is
the
it like an
guidelines.
accepted norm? Is that what it
Yeah,
is? It's just everybody has kind of fallen into an accepted norm. It's like, okay,
yeah,
when somebody comes to me and, you know, their A1C is such and such, and we know that they have type 2 diabetes, we know that we're going to put them on metformin. We know that
yep.
we're going I can remember when I was first diagnosed, they put me on blood pressure medicine, and I have never to this day, when I was
Mm-hmm.
400 pounds or now, I have never had an issue with my blood pressure. My blood pressure has
Like
never
this.
measured high, but they
Okay.
put me on it and they said, oh, it's to protect your kidneys.
Yeah, I
They
can
put me
explain
on
that, but it's
cholesterol.
something.
Yeah. And they
Yep.
put me on cholesterol medicine for the same. I didn't have high cholesterol, but they put me on
Yep.
cholesterol medicine anyway.
Yeah.
So it just kind of makes you wonder what the reason is behind all that.
Okay, so I've thought about this a lot. I've given a lot of detail, like a lot of thought, because when you're trained at the level like I'm trained at, like a stupid amount of school years, okay,
Mm-hmm.
you naturally should progress down the lane I'm in, where okay, you looked at the research. This is what you were told, but the clinical research has developed, and I should be looking at that, and I do, and oops, okay, I need to switch my practice. But that's not what happens. One, because we're super busy. Every patient has what, 5 to 7 minutes with their provider. That means the
Yeah.
provider has even less time to update themselves. Okay. And so all they have time to look at is the clinical guidelines. And they're trained in school to what I call, this is what I call it, running the program. Okay. When
Right.
they step through the doors of that clinic, when they step through the doors of into their exam room, they run program. Okay. They
Mm-hmm.
are no longer Heather. They are Dr. Smith. Dr.
Right.
Smith is a good doctor who reads the guidelines and
Mm-hmm.
gives that advice to their patient. And,
Right.
it's hard to shake people out of this. It's even hard to talk to them about it because they're insulted. They're like, what do you mean? I turned into like some program zombie? And I'm like, yeah, you kind of do. There's a human
Yeah.
being in front of you.
Mm-hmm.
Okay. They have relatives like you. They have problems like you. They have worries like you. So treat them like you would treat you.
Right.
And they kind of don't. We have this barrier and it's unspoken. It really is that they run program. But once you snap out of that program, it's much easier to just give your patients and your people what they need, because what they need is another human to see them as a human and do what is best for them, not what will
Yeah.
make things worse. And unfortunately, the program says to follow the clinical guidelines, even though it says right there in the title that they're guidelines. right? And that's another programming. So
Yeah.
It's funny. I'm actually developing a course to snap people out of the program. It's tricky. It's tricky. It's going to take.
Sure it is.
It's going to take some development. But these people with good hearts, they go into the clinic and they stop being that person. They start being the doctor, the nurse, whatever the program. And they start running the program, right? And patients do it a little bit too. They start running program. They get into the doctor's office and they're the good patient who took their blood pressure every day. No, you didn't. Who had time for that?
Right.
And I don't ask, do you miss your meds? I ask, how many times have you missed your meds this month? Because of course you did. You're human. Yep. Okay. I don't even know what day it is some days. You're going to tell me you didn't miss a pill? Yeah.
Yeah, exactly. You know, and that's the thing. I think that not only people themselves, but, you know, other people, doctors, nutritionists, dietitians, personal trainers, all this stuff. You spoke on running a program, and all of these people in one form or another have that program that they run. Like, in my field, what I do, so many nutritionists and personal trainers, they have these set cookie cutter programs, and they hand out the same damn crap to everybody, and they expect everybody to yield the same results, and it doesn't happen. And what they wind up doing with the people that they're working with is they wind up building so much doubt into them that they feel like it doesn't matter who I work with. It doesn't matter what diet I'm on. It doesn't matter any of this stuff. I'm never going to be able to fix this. And that is 100% untrue. People need to realize that because we are all individuals, you know, I mean, the snowflake culture is that way for a reason, I think, in one aspect, because we are all unique. We are like snowflakes. So you can't take one medicine, you can't take one nutrition protocol, you can't take one exercise protocol and just hand it out to everybody and expect it to all work the same.
No. And it makes me a little bit crazy when I see that. And I've seen books that are set up like that, you know, nutrition for people with diabetes. And I browse through it and I'm like, there's more carbs on here than someone without diabetes. Well, what are you doing? You know, and then their diabetes gets worse and they need more pills and they wonder what they did wrong. Actually, I kept documentation of some progress notes from this one patient of mine who was my favorite, who did exactly what he was told by this one particular nutritionist. Okay.
Right.
Went back to the clinic. His blood sugars were worse. He was up like 4 pounds, did exactly what he was told. And then in the notes was like, didn't exercise. Right. So no matter what, he was blamed.
Yeah. Yeah. It's always their fault.
Instead of being like, well, maybe you should look at what didn't work for that patient. Like you gave them something to do. It didn't work. That's on you. You have to look at what you didn't improve. No. It's much easier to say the patient wasn't compliant, adherent is the words we use.
Well, it's passing the buck.
Like, yes, it's
yeah, and it's horrible. It is absolutely horrible. It's like I have a friend, and he was actually the second guest that I had on my podcast. His name is Mike Gorman. They call him Gormy. This guy, he lost 300 pounds, not once, but twice. He lost it, gained it back because he didn't change his mindset, and then made another pivot and lost it again. But there was one particular time that he was in the hospital, and he told them straight up, he's like, look, I've been having problems with my blood sugar. So when he was selecting the meals that he was going to eat, he selected a diabetic breakfast. The next day, the diabetic breakfast came, and it was 2 cups of oatmeal, a bunch of fruit, a toast, and juice. Yeah. So it was like nothing but carbohydrates. There was little to no protein, no healthy fats on the plate whatsoever. And he's like, what the hell is this? This is not going to do any good for my blood sugar whatsoever. And he was in a hospital.
I know. And I hear this a lot. And then, you know, my brain starts seizing because it makes me crazy. If you use juice to bring your blood sugar up when you've overdosed on insulin, you should not be putting it in your body on a regular basis. Okay. Right. And you know, it's funny, like even they switch like, oh, you have diabetes. And again, they like double the carbs. And I'm like, what are you doing? You know, there's like this mindset, this misconception. Even people who are really not familiar with diabetes will say stuff like, well, you have diabetes. Don't you have to eat every few hours? Well, his blood sugars are 400. I don't see how food's going to help anything. at this point. And every time I go through with my current clients, I'm like, what was, your last appointment, what did they say? Let's go through this. People are always being prescribed more food.
Yeah.
Oh, I noticed your blood sugar was this. Why don't you have a little snack then? I'm like, how about you decrease the dose of the drug then?
Mm-hmm. Exactly.
How about we do that instead? And there's, and I say this a lot, I'm a little obsessed with it, because people are like, Dr. Ellow, what can I take? What can I do? What can I supplement? What can I eat? And I'm just like, why don't we practice the art of not taking? Because that is the most magical. Okay. Mm-hmm. It was like, what can I add and pile and no, why don't we just not? Okay. Once you step back and do less, and actually things will start to correct.
Yeah. And I like to tell, the clients that I work with the name of my business is T2 Nutrition and Wellness. So I get a lot of people that are type 2 diabetics. And I like to tell them, if you're going to do anything, if you feel like that you need to take a pill or something like that in order to help you, there are plenty of herbal things out there that will help you. Cinnamon helps you. Apple cider vinegar can help you. Berberine can help you. There are a number of different herbal supplements that you can take that don't cost anywhere near the amount of some of these medications, and they don't have long-term harmful side effects.
No, they don't. And I feel like sometimes we use it almost like the placebo effect works, right? Because I almost feel like people are like, I feel better when I take the cinnamon. I'm like, go crazy with cinnamon. Like, who cares? Cinnamon's amazing.
Yeah.
Whatever. It's not going to harm you. But just putting that pill in all of a sudden, it's like, okay. So first of all, we have to work on your pill thing there, because, but
right.
All right, let's look forward. But if this kickstarts you into seeing the success and then wanting to keep going, let's do that. Let's do that. Okay. Because a lot of the pills, and again, as a clinical pharmacist, people are like, don't you want people on medicine? No. Why would I know too much. Why would I want that? Okay. I know way too much about that stuff. But a lot of the medications are not set up. I shouldn't say that. Work in a way that focus on the blood sugars, but at the back end make insulin resistance worse, which is what is pushing type 2 diabetes forward. The insulin resistance, and we're giving them pills that pushes the disease forward while lowering their blood sugars. And that is like the biggest, like the seed of all, because they think they're doing something that's helping them, and it's not.
But let me ask you now, I know how I feel about this, and I know I've read a number of research articles and whatnot. What are your thoughts on obesity being the main cause of so many issues, not just problems with diabetes, but everything? Because I've actually caught some heat. I did a live video on Facebook, and I was talking about how, at that point in time, I think there had been like maybe 900,000 deaths from COVID. And I was like, look, causation of obesity killed 2.8 million people last year alone, and it's growing every year. Why are we not discussing these issues? Why are we not putting the focus on obesity that is being put on this type of stuff? Yeah.
Why don't we talk about that?
Yeah, exactly. Well, no, we don't even want to begin to talk about that.
No, we don't have time. So when we put, okay, so let's go back to our common sense realm. I love to live in the world of common sense. How big were we 50 years ago? How big were we 100 years ago? Okay, was seeing somebody overweight a commonplace thing? Probably not at all. In fact, we have shows now that are recurring, like my 600 pound life. Why is that a show? And why are there so many
popular?
Why are people eligible to be on there? Why do we have so many people eligible to be on there? Like, we're doing something fundamentally wrong with our human nutrition. We're the only mammals on this planet who have no idea what the heck we're doing. We've lost all of our instincts. We're the only ones who drink anything but water. Okay. And then get upset when somebody tells you to drink water, which is really what keeps us alive. Like, we've lost our way when it comes to, I am this species. What should this species eat? And if you're like an alien looking out from a different planet, it's kind of like, well, they don't know what to feed themselves, so they give them these weird pills that somehow try to hide the damage that all the food is doing, but then it causes more. Like, we must look like crazy people if there are aliens looking down on us right now. I'm just saying, like, we don't do anything that makes any kind of sense. We don't stop and say, I mean, let's not talk about the emotional issues that cause, because I think we sometimes really know what to do, but we don't want to hear it. Like, we're not ready to hear it. Okay.
Right.
But if you just take a look around, we're not healthy. In the world where we have close to 5,000 individual unique chemical entities for pharmaceutical products, and we are so far away from where we are as a healthy species, that should just be like that. There's your sign, right?
Right.
Diabetes is increasing at an increasing rate. There's your sign. Okay.
Yeah.
And I think one of the biggest lies we've been told, and one of the most, one of the nuggets that really puts people in a victim like mentality where they don't do anything about their diabetes, is when somebody says, oh, it's genetic. Okay. And that's hard to unpack, right?
Yeah.
Because people will be like, well, look at the evidence. My mother has it. My auntie had it. My brother had it. My brother died from it. Right. Obviously it's genetic. I'm like, but that doesn't mean there's nothing you can do to make your life better now. And people, they fall into this, it's genetic, there's nothing I can do, give me the pills. And I just don't understand that. And it's worse when it comes from somebody like, a medical professional tells them, their trusted primary care physician tells them, their NP, their PA, their nutritionist, their dietitian, people on Facebook, Lord, they don't, and I think there's something in there to try and make them feel good. They don't want these people to think, oh, it's your fault, it's genetic, but that doesn't help. That doesn't help enable you to make changes. That just puts you in this place where it's not my fault, therefore I don't have to do anything. There's nothing that will help. I can't change anything. This is what
it's the blame game.
Come on.
It's the blame game, Krista. That's exactly what it is. People are always looking for something or someone to blame.
It's a reason.
Can you be predisposed genetically to diabetes? Sure you can. Absolutely.
Sure.
But especially type 2, what is going to trigger that type of stuff to come upon you is the way that you treat your body. When I was in my 20s and 30s, if I didn't spend every day eating a whole pizza, a couple Big Macs, and a large vanilla milkshake for lunch, I probably wouldn't have gotten to 405 pounds, and I probably wouldn't have developed type 2 diabetes. But I did. But just because I did doesn't mean that I couldn't take steps to reverse it. And that's exactly what I did. And so many people are always looking for that. Well, it's because of, exactly. It's because of this that there's nothing I can do about it. This is my lot in life. So I just have to take my medications that so-and-so tells me that I need to take. And, as long as I take those medications, I can still do what I want. I don't have to exercise and I can eat whatever I want. But, the medicine's going to save my life. And that's not always the case. As a matter of fact, in most cases, it isn't the case.
Yeah. And that's been a struggle trying to explain how drugs work. People think, okay, I have this drug in me and it's going to work as hard as I eat. Right. And it's just like, no, you can out-eat any pharmaceutical product. Yep. And so a lot of people, when they come, they're like, oh, that drug stopped working. And I'm like, that drug didn't stop working. You out-ate it. Okay. Yep. And it's easy trap to fall into, right? It's like, here's a pill is for your diabetes. Okay. Well, that's not a cure. No. That's a Band-Aid. Okay. That's just going to, and most of these meds we have, they don't take that extra sugar and get it and push it out of your body. There's a few that do now. They stuff it somewhere. They stuff it wherever it can. And the insulin resistance gets worse. So most of the meds we use are a Band-Aid and they make things worse. I can do this just about with any chronic illness, honestly. Hypertension. Yeah. People are like, oh, there's no reason. We don't know the reason for your hypertension. There's always a reason. Your body is doing something. Okay. Let's find that reason. Let's dive down. And that's, I think, where this other group of medical people who are doing functional medicine, that's where I think that came from, where they're just sick of just Band-Aiding stuff and going about their day.
Yeah, exactly. And that's true. You are seeing, you're seeing a lot more people who are using functional medicine and even alternative medicines that are having great results in a lot of these different areas. And I think it's because at the heart of it all, they're focusing on more than just giving somebody medication. They're drilling down and trying to find out what it is that's causing it. It's like you can take somebody that's 150 pounds overweight that has high blood pressure, and then you can take another person that is only 20 pounds overweight and they have high blood pressure. And there may be two entirely different reasons as to why each one of them have high blood pressure. And unless you investigate, unless you actually work with someone to try to figure it out, you're never going to know. And it's not just a matter of handing them a pill.
No. And, I've saved people from opioids that way. I really have. Because, and I encourage anybody who hears this to ask questions. It's okay to ask questions. You're supposed to ask questions. We've been trained to don't question your doctor. You better, they're human. I've had people question me. I don't get offended. Okay, I'll give you the answer. But I had this one gentleman come in. He had massively horrible headaches. He didn't know what it was from. And they were going to send him to the neurologist. They were going to put him on a pill, give him an injection, give him an opioid. And I'm like, what's your job? And I'm not trying to brag. It's just like, you got to ask questions. What do you do for a living? What do you spend your time doing? What's going on? And after we talked, I'm like, you need to see a chiropractor. He went to the chiropractor, got adjusted, and the headache turned off. And I'm like, you were about to start a life of opioids because your spine, you were strengthening the musculature in your spine for an awkward position instead of strengthening it for a normal position, causing massive migraines. Your diet didn't probably help. I mean, he's living the bachelor life. But he was about to go just get pills to treat this headache. Right. And it's like spaghetti. Whatever sticks to the wall, that's the answer when it comes to that kind of pain. It really is. There might be an algorithm, but that doesn't mean it makes any sense.
Right.
Okay.
Right. And even that isn't going to be accurate 100% of the time.
No, ask the questions. What are you doing? Like that was super common sense. You're hunched over. I think he was a forklift driver, and lifting stuff. And I'm like, you need an adjustment. And it wasn't paid by the insurance. I think that was the other thing too. Like chiropractor isn't paid by insurance. So they're steering us down this avenue of drugs. And it's just get adjusted.
Yeah, for sure. It's like, now I want to ask you a question because in our conversation before we actually were actually able to sit down and record this episode, you were saying that you had gone back and you had actually watched my podcast episode on No Sugar, No Grains with Vinnie Tortorich, and that the gentleman that I had on, Scott King, to start with, was my first introduction to that whole world. He is a big proponent of DDP yoga, and you said that you've actually utilized that to help people, and you just kind of touched on that a little bit. So why don't you do a little deep dive into that, as far as not just necessarily a chiropractic adjustment, but how people can utilize things like that in their everyday life to alleviate pain and things like that.
Yes. It's funny, but my brother's an exercise specialist, and he saves people from surgery, because when we're prescribed physical therapy, we're prescribed it for this long, right? And that should cure everything. Right. When we really need like lifelong physical therapy, exercise, movement, flexibility, strength. And when that little bit of physical therapy didn't work, we go immediately to surgery to stitch something up that we don't even know is wrong. And so I stumbled onto DDP yoga by accident, because I'm like, oh, I remember that guy. He was like, anyway, from the 80s wrestling people.
Oh,
and yes. And so one of the videos I saw was a paratrooper whose body had been destroyed, right? Jumping out of airplanes. Something I was very familiar with, working with the Department of Defense, working in the VA, getting trained in the VA. I've seen these people come back and they're a mess. Yeah. And all we want to do is give them pills. And I'm like, you need to put your body back together in the parts as best you can. Okay. So you don't have that chronic pain. If your body is not where it's supposed to be, the parts are not where they're supposed to be, there's going to be pain. And there's no amount of drugs that are going to cover that pain up, because your body's constantly going to send that signal any way it can that there is a problem. Either you're going to be in pain, you're going to be depressed, you're going to have anxiety, you're going to have some kind of issue mentally, but we keep pushing people towards the pills when we really should be pushing people to move their body again. And people are afraid to move their body when they're in pain, but actually the opposite should be true, right? They should be wanting to move, because that is what's really healing them. That is what's going to heal. That increases circulation and make sure the nutrients get to the parts that need the repair. If you've ever met anybody who had a double knee replacement, a single knee replacement, they don't let you lay in bed. You are up and out, moving, like within 12 hours, something crazy. So why
I
aren't we
was
applying
home.
that to
I actually had knee replacement surgery. I was in the hospital. I was in the surgery center at 6:00 in the morning. I walked out of the surgery center at 2:00 in the afternoon on a walker, got in my car and drove home. Well, rode home with my wife. So yeah, you're exactly right. It's all about moving, for sure.
Just move. And DDP, I don't know if this is a pitch for DDP right now, but you know, he does it in a way where he's like, my body's injured and beaten, and I jumped off of, into the pit and wrestled. And so he puts it in a way where people who already really can't really move well can start to move again. And that's where you got to start. I think people get screwed up because it's like, well, this person's doing like jazzercising. I can't even stand up properly. I'm like, well, that's where you know where to start. Start by standing up and then sitting down and then standing up again and then sitting down again. And I actually made a couple of my clients do this. And after like 5, they're like, wow, I'm winded. I'm like, I know. Do it 10 more times. Yeah. Do the movements you're supposed to do every day. Strengthen those muscles. I think we're caught up, like, as you said, in the program of here's a specific program I need to do, and here's a specific exercise I need to do. And we've really complicated things. Just move. Okay. Feed the human body what's supposed to. Okay. Yep. All right. Like, and don't eat when you're not hungry. That's one of my top 3, I think. A lot of common sense that the noise is crowding out. The noise is just crowding all the common sense out. And we're living by other people's way of thinking.
Yeah. And that's, I talk so often about how the quote unquote diet industry is, there's a reason that it's a multi-billion-dollar industry. It's because we as human beings, we're the type of creatures that we're just like a cat in a way, because we're attracted to shiny things. If we're not happy, with our body, if we're not happy with our current state, our current life situation, we can be focused on something else. And we see that little shiny thing popping up over here. And then it's like, oh, that's what I need. And we'll make that pivot and we'll head in that direction. So many people get trapped up with that when they're on a nutrition protocol. They'll lose some weight and it's like, okay, well, now I've plateaued. So now this isn't working anymore. And they don't make any adjustments. They don't change what they're eating. They don't look at their macronutrients and say, okay, well, I'm not the same person I was when I started this 2 months ago. I've lost 20 pounds. So now I have to recalculate things and start all over again. It's just the way we are as human beings. And I think that so many industries like the diet industry and, so some of these other industries just kind of play in on that. And they
do. And it's just, when I'm sitting and actually reflecting on like conversations I've had with people, what's ironic is we've always had the answer. Yeah. We've always had the answer. Eat what's appropriate for the human body and don't stop moving. And we've kind of done both of those things pretty badly. And, it's almost like if it's not complicated, then it probably won't work. That's almost our thinking. Like it has to be really complicated. Otherwise it's not going to work. And it's like, really not. Right. It's really not. And, I have a client who she's lost 32 pounds right now. Her A1C went down 2% in like 8 weeks. Okay. Yeah. And I'm just like, don't eat when you're not hungry. Get rid of the junk. Okay. Yep. Get off the diet soda. Okay. Start there. And it's like magic. It's, everybody's looking for magic and shiny and glitter, but the stuff we can do right now to help ourselves is just like magic because it works that quickly. Your body's like, oh, thank you. Jeez. Why was that so hard? Why you keep stuffing that other stuff into me? Right. Why are you constantly feeding me? I'm full.
Yeah, you're right. You're right. It's like I had a client that I actually met through a Facebook group that I'm a resident coach in, and he reached out to me because he's like, look, man, he said, I entered this weight loss competition. Right. And, all these coaches and stuff, they set up these challenges all over the place. And this guy, he enters this thing and he's like, look, he said, I like immediately, I cut my calories in half. And it's like, I'm 2 weeks into this, and he's like, I'm just not losing any weight. He's like, and I'm doing cardio 6 days a week, and I'm lifting weights, and I'm doing all this. So I was like, look, I said, send me a day's worth of eating. Let me know what you're eating for a day. So he did.
Mm-hmm.
And I ran through his numbers, and he was literally like 1,100 calories under what he should have been eating. And I mean, this guy was in the gym busting his backside like a beast.
Oh my God.
And yeah. And it's like, So I told him, I said, well, here's what needs to happen. I said, I want you to eat this much protein, this many carbohydrates, this much fat. And we're going to increase those calories to all but about 500 calories of what your maintenance is. That's going to give you a good, healthy weight loss, right? So he does this. 6 weeks later, he'd lost 19 pounds and he won the daggone contest. And he hit me up afterwards and he's like, I don't understand it. He said, because I have been trying to lose weight long before this contest. And I've always thought that in order to lose weight, you have to eat less. And you had me eating more than what I was doing before I tried to do any of that. And I lost weight. And I was like, it's not all about how much you eat either. It's about what you eat and when you eat it.
Quality. Yes. Yeah. And I've had people, and this is where, people are really taught, and I'm sure you've heard this yourself, like, well, as soon as you lose all the weight, then the diabetes will go away. Okay. But then, so they try all the diets, right? And all the diets are really high in carbs and sugars. And I'm like, and they can't lose the weight. And then they get put on another drug. They make that deal with their doctor, like, I'll lose the weight and then I won't need another drug. And because they are convinced, the doctors tell them that if you lose the weight, the diabetes will go away. It's no, just start eating appropriate for stop, put the Slim Fast down, put it down.
Yes. Oh yeah.
Put it down.
Yep.
There you go. Okay. And then, I laugh because people message me, they're like, I've started this diet. What do you think about it? And I'm like, Lord, help me to not be super rude about this. And, because I can be very, not meaning to be, just be very honest.
Yeah.
And it's just like, that's not going to help you at all. It's almost guaranteed you're going to have another medication coming very soon. And they message me weeks later and they've started a new medication. It's not about just the weight loss. You can't just starve yourself into not having diabetes. You can't starve yourself into being, you have to feed the body appropriately. And yes, actually taking some fasts every now and then, that's also okay. We used to do that. We should probably do it a little bit more. But yeah, we're just so out of tune. We're just so out of tune with our, as a human.
It is. It's not, it's really, when you sit back and think about it, like with the advance of the keto craze, and now everything you see everywhere is keto. It's like, would you give me a break? If you sit and you look, the best advice that anybody can get if they're worried about losing weight, if they're worried about controlling, cholesterol, blood pressure, diabetes, whatever, it's this right here. It's called a nutrition label. Learn to read it. Learn to read it and learn to read what is in what you are putting in your body. If you do that, you are 90% home. 90%.
Yes.
So, all right, before we run out of time, I know that you created a program that you actually use with people that you work with to help them get off of meds, or at least have to take a whole lot less. So why don't you describe for the audience what that program's all about and what it's kind of centered around?
So I actually was trying to figure out how I can give everybody what I do for people in the clinic in one package, instead of, having 12 follow-ups with me in the clinic. And so I created the 30-day blood sugar reset challenge. And what this does is, it tells you what to eat, what not to eat, but also tells you why, what to expect. And also, I think one of the most important and vital pieces is it hits up the mindset. Because if the mind is not in the right spot, then the body is not going to be either. And usually that means in line at the ice cream store, or at line, picking up your pizza. I've been there. This is why I know this so well. Okay. And so it doesn't just give you, because, as you said, here's the menu, follow the menu. It's do this week. Okay. Slowly wean off this food this week. Pay attention to how you feel. Pay attention to what your thoughts are. Write down your blood sugars, okay? Because honestly, I can't tell people anything, right? I can't tell people anything. I got to show them. And so do this with this food this week. and show yourself what has happened. Write down how you feel, and then make sure you write down why it's important to keep doing it. I think that's one of the biggest things we miss is people forget to, visualize, like, why am I doing this? What do I want to avoid? What am I trying to get rid of? What do I want more out of my life? Because when you're burdened by that disease, that diabetes, it's exhausting. You're not your full self, the full self you could be. And I'm like, people need to be doing this. People need to be resetting. And one of the big things I address in there, of course, is like we talked about, the all or nothing problem, the Monday morning restart, the redo, just keep doing and making those small choices every single day, and you'll get where you need to be. And that's exactly how it's set up. Day 1, do this, this, and this, you're done. Day 2, this, and this, you're done. Congratulations. Day 3, do this, and this. Think about this and write this down. Now you're done.
Mm-hmm.
And, by the end of 2 weeks, their blood sugars are lower. And they're like, are you kidding me? I'm like, I'm not kidding you. This is how it works. And so by the end of those 4 weeks, I'm not going to lie, threw an extra week in there to give them a warm up. By the end of those 5 weeks, they're like, I never knew that food was a problem, because I just assumed since somebody told me it was healthy that it would be a problem.
Yep.
And so it's my way of being like, here's everything I want to teach you. I'll be right here if you need anything.
That is amazing. And I'll tell you why I feel that way. First of all, you didn't overcomplicate it. Secondly, you're giving them each day, you're giving them a small win, which I think for anybody who's struggling with anything like that is crucial. So many times a diet plan or an exercise plan, there's no small wins involved. It's all about the outcome. And when it's all about the outcome seems like it's so far away that if you have those moments where you have those wins each day, first of all, that does something in the mind. The mindset is key. I don't care if you are the best doctor in the world and you're prescribing the best medicine in the world. I don't care if I'm the best nutritionist in the world, trainer in the world, whatever. If someone's mindset isn't right, if it isn't at a point where they're able to absorb what it is that you're trying to teach them and be able to utilize it to move forward, nothing is going to work. And that's what you've done with that program. You've given them the small wins, which constantly is reaffirming their mindset. You've got them focusing on their why at the end of the rainbow, which is fine. And, they spend so much time focusing on the individual wins each day that by the time the 30 days is over, they don't even see the outcome until it's already there in front of them. And that's amazing. I
gotta
really
tell
like
you,
that.
It's very hard. It's hard to teach somebody what a win is.
Yeah.
I'm like, tell me what your wins are for the day, because there's like 4 weeks of virtual coaching and a group session included. And I'm like, what's your win for the day? He's like, oh, I don't know. I didn't do very good. I'm like, how much soda did you have? Oh, I cut it in half. Hallelujah.
There's a win. There's a win.
You have any idea how hard it is to cut soda down? It's so addictive. And I'm making an enormous deal out of it because it is a huge deal. And they start to realize, oh my God, I am a rock star. I'm like, damn right, you're a rock star. Let's keep going.
Yeah, exactly. That is so awesome. All right. This has been absolutely amazing. I had no doubt that it would be. And like we were talking at the beginning of this, with all the struggles we went through to actually get together and do this episode, that had to be phenomenal. So before I let you go real quick, why don't you let everybody know where they can reach out and contact you?
Oh, sure. Yeah. Well, the easiest is on Facebook. If you're on Facebook, Krista Ellow Diabetes Health Coaching. But some people hate Facebook right now. So you can also go to www.drkristaellow.com, drkristaellow.com. And I have little goodies in there. I always love freebies because I feel like it's, you should be rewarded for that first step of even going to look to see if a diabetes health coach could help you. And here's a freebie just for taking that step. I just feel that way. All right. So it's drkristaellow.com. That's easiest. There's a contact form. And of course I have a coupon code if you want to do the 30-day challenge, and I will make sure that John has that, but the Facebook, and my personal website. And because I check those all the time. I'm constantly in there doing that. So
awesome. Yeah. And I'll drop all that stuff in the show notes too, so people can see that as well. Krista,
perfect.
Thank you so much for taking time out of your schedule and working through all the struggles that we went through to do this episode. I had a great time. I have a feeling I could sit here and talk to you about so many things for quite a while to come. But so you have an open door invitation if you've got anything new going on, if you release a new challenge, whatever. If you ever want to come back on the show and discuss anything new or whatever, by all means, reach out. I'd love to have you.
Awesome. No, it was my pleasure. I had a lot of fun. I love talking shop. I love doing it.
Yes, yes. It's amazing. Isn't it? Really okay, is. Sit tight 1 second. I'm going to run over and wrap this up. I'll be right back with you.
Okay.
All right, folks. You know the deal. Another amazing episode. Krista, I love her outlook on what it is that she does. The fact that she came from, well, I say came from, even though she's still technically a pharmacist, but she came from that world and she used what she learned to make a pivot, and she's helping people with what I feel is one of the biggest problems in the world today. So do me a favor, make sure that you like this video, share it with a friend, subscribe to the channel, hit the all button, do all that stuff. You guys know what to do. I don't have to tell you this every week. In the meantime, until I see you guys again, playtime's over. It's time to get to work.